Good evening, good evening, good evening, and welcome to Couch Conversations with the Doctors, where health is wealth. What's tonight? It's Monday night, and Monday night is time for Couch Conversation. So we just want to remind you guys to share once again because it is Monday night, and it is time for Couch Conversations with the Doctors. As always, we're going to go around our panel, and we're going to introduce our esteemed medical panel that we have here so they can begin to share with you all the great things that you need to know about staying healthy. I'm going to start first with the man who's really a chef extraordinaire for his family. I mean, those girls at home, that's our very own Dr. Bonnie P. Thomas. Dr. P.
Hey, Nikki, to my esteemed panel, I'm happy to be back. I missed you guys, and I'm looking forward. I missed the community. I missed the questions, so I'm looking forward to see if we can answer some questions and hopefully help people to live a healthier life.
Outstanding, outstanding. Dr. James Miller, the man who says that I threaten him to be here on every Monday, but he's been here when I wasn't. Go right ahead.
Good evening. Good evening. I want to say thanks to Nikki and to Congressman Davis for providing this forum for us, which I think, and hopefully, it is providing some useful information for the people of our community. Again, my motto for 2023 is let's get rid of the craziness and let's get things moving in the right direction. Let us come together so that we can solve some of these issues, whether it be health issues, whether it be social issues. I mean, we can do this together. The saying that together we stand, but divided we'll conquer. We're gonna fall. So let's get together in 2023 and be productive in terms of making life better for everybody.
Outstanding, outstanding. To my co-worker who leaves me and dumps me on the side of the road so he can go and be in sun and fun. That's our very own Dr. Douglas Graham. Dr. Graham.
Hey, Dick, I appreciate the invitation. I am also a retired physician. I worked in the western suburbs for about 30 years. I spent 2 years with the congressman in his office. An amazing experience. I just want to comment, Nikki, that the door's always open. Easy putting out a seat at the table. You're welcome to come out and enjoy the sun and fun if you can. And I'm going to see what I can do to help the community. I appreciate the outfit.
Okay. That doctor that everyone knows is Dr. 100. The doctor who keeps it real, our community vanguard on medicine, our very own Dr. Maya Green. Dr. Green.
I mean, keeping it 100, Dr. Graham. Send me to Addie. People like the door is always open. Well, let's see. Let's see what you mean by that. Text me to Addie. All right. Thanks, Nikki and the Congressman Davis for putting this together. I'm always excited to learn from the community and join my esteemed colleagues here. I'm looking for that text. I'll let y'all know. And Dr. Graham, send a text like he said. Let's see if the door open.
I'm gonna be waiting too.
Text us to Addie. We'll pull up.
Maya, you got to change your name to Dr. 100. I got to, you just kept it 100. You did.
We'll pull up. You ain't nobody fly away.
They're pulling up. Want to say hey to Sister Bonnie, who is here with us on this evening. To Audrey Jaycox, who is here, and she's saying good evening, everyone. To Connie Taylor, who is here, and she's saying good evening. Our guest is trying to get in, and I think he's having some problems. His name is Dr. Marvin Jackson, so I'm trying to wait and see if he can actually get in here. But he's trying to come on in. While we're waiting for him to get all of his technical stuff together, we're going to talk about this new COVID vaccine and all these new COVID variants that's hanging out. So Maya and Dr. P, what's with COVID and all its new cousins?
Well, CDC not too long ago released a study that said if I compare myself to, if I get this vaccine and I compare myself to people who've not gotten any vaccines, I'm 9 times more likely to be covered in this round of COVID. And compared to people who got like 1 dose or 2 doses, I'm 4 times more likely to be covered. So while we're hearing things that, you know, the vaccine may work, the vaccine doesn't work, all those other things, I mean, history repeats itself with the kind of this story, you know. But the main thing that I think we were stressing is A, we do encourage you to get a vaccine. B, whether you get the vaccine or not, when you're out in public spaces, over the nose, under the chin, again, no headband mask, no beard mask, no mask hanging off one ear, none of that. Old school cell phone mask. Remember that cell phone thing hanging out one ear? We don't want to see any of that, right? And those are the things we have to do when we talk about public health and protecting our communities and our tribes. We don't want you to get to the hospital on a ventilator. And yes, there are people on ventilators in the hospital with COVID in Chicago right now. Okay. The ventilators are out. We already know who they're going to give the ventilators to. Let's not do this again, right? Over the nose, under the chin for the win. Boom. Be a wrap.
Pete, didn't you call her Dr. 100? That's
100. Look, I agree with Maya, and I would just say, just to add on to that, you know, it really essentially means we're doing our job. When the virus is trying to mutate, that means it's trying to survive. Okay, that means we're doing a good job in eliminating as many hosts as we can. And so by getting more people vaccinated and up to date vaccines, then we are essentially minimizing or limiting the amount of hosts that the virus has. So, and then to Dr. Meyer's point about wearing the mask, you know, it's COVID, but then we have the other two that we're getting hit with, which is RSV and the flu. So just keep that in mind. RSV, flu plus COVID, we're getting hit with the triple pandemic that's happening. And so the mask will help. So no, I'm not saying don't pick between the mask or the vaccine. Do both. Get your vaccinations, be up to date, because that will protect you. But then also wearing the mask will protect you from flu as well as RSV.
So what is RSV exactly, Dr. Pete?
It's called respiratory syncytial virus. And it's a virus that prior to the pandemic, probably, you know, there's two sets of people that were particularly affected by that. Was the infants, really young people, and then really, really old people. And what happened essentially is because we were doing such a great job of wearing our masks, putting on the gloves, and making sure things were disinfected, that virus essentially had no hosts, essentially. Okay. And then our immune systems were, because for the past 2 years had not had any exposure to it. Essentially, now that people are taking their masks off and they're all in these public places and crowds of people, and this virus is like, oh, y'all forgot about me, huh? I'm gonna show you, but you know, it's like I can show you better than I can tell you. And so, and it's not just affecting infants and elderly people; it's affecting all the people in between too, particularly people with chronic health conditions like COPD and diabetes, heart failure. So yeah, it's again, we don't have a vaccine for RSV, but we can definitely do our due diligence by wearing our masks and keeping our hands clean.
So unlike COVID, RSV maybe has a treatment.
Well,
is that it?
Well, I mean, essentially, we treat people who have respiratory failure or anything like that as a result, because really what's happening is your body mounts an immune response, and it's that immune response which essentially makes us sick, right? So the idea here is never get the infection so you don't have to worry about becoming sick and eventually needing respiratory support. But I don't know if any of my colleagues want to comment on that.
Well, Dr. Miller is nodding his head, so I think he's ready to say something.
Yeah, well, this the respiratory syncytial virus has been around for a long time, and it's but as Dr. Pete said, it mostly in when I was practicing, I usually only saw it in people who had COPD, asthma, some kind of respiratory condition that compromised them, and that they would get a virus, and now they're already partially compromised respiratorily speaking, so the virus would cause them to become ill. So it's been around, and so a lot of the things that we're seeing now is the effect of multiple things happening at one time. Like if it was just respiratory syncytial virus and we weren't dealing with some of these other issues, it'd probably be less of a problem. But with these things occurring together, being being transmitted in pretty much the same way, it just put people at risk of multiple disease processes. And I think when I really went back and started, after I began to look at a few things, the first year of COVID, the flu wasn't so bad, because I think more people were concerned about protecting themselves from COVID, and they were also protecting themselves from the flu. But as Dr. Peter says, that as we've gone along and people have have become a little less fearful, and maybe a little bit more adventuresome in going out and doing things that they don't think are going to cause them as much problem. And I think the big thing that we are, I've always, as I talk to different people in my family and people in the community, is that for young people, these problems are not as doesn't cause as much morbidity. They get the infection, they do okay. The problem is that they interact with older people, and therefore, and people that are sick or have multiple comorbidities. In come the problems. Those individuals are now have a more difficult time struggling with their health during their infection.
All right, Dr. Miller. Last question, because our guest has everything together now, so we got to introduce our guests and everyone else who has come in. There's a question there's an anonymous question that says, how many vaccines should we actually have? And can you catch COVID, RSV, the flu, and pneumonia all at one time?
So I'll go backwards. I guess theoretically you could. It would probably be difficult to isolate, which one you have. I can tell you we have Paxlovid to help to treat COVID within the first 5 days. We have Tamiflu to treat the flu within 72 hours. So just to answer your question, that's a yes by theory, but in practicality, probably more difficult. You're going to get one or the other, or maybe two, but probably not all four. What was the other question?
What vaccines? Are there vaccines for the other things?
Yeah, so there's vaccines. We have vaccines for flu, for pneumonia, and COVID. And to my knowledge, there's not a vaccine for RSV, but in my family medicine, people could comment on this.
Okay. So Maya, you're muted. You're speaking, but you're muted.
There's not.
Okay.
Okay. Outstanding. Want to say hey to Connie Taylor. She says good evening to everyone. Nellie Purnell King is here and she says good evening. Yolanda Williams says good evening. Dorothy Murphy says happy to be back in 2023. Kathy Jones is here and she says good evening to everyone. Angela Taylor is here and she says good evening just as well to everyone that's here. Dr. Marvin Jackson is here with us on this evening, and so is Dr. Ansel Johnson. So Dr. Johnson, why don't you give us a brief introduction real quick since you missed our intros, and then I'm going to transition right over to Dr. Jackson.
Okay. Thank you very much. Am I muted? No. Okay.
We can hear
Dr.
you.
Ansel, no, I'm not. Okay. I'm Dr. Ansel Johnson. I'm an optometrist, and I'm just honored to be here on this illustrious panel. And what we do that's a little bit different, we connect the body health with the eye health. So the vision and the eyes are connected to the body. They don't operate in isolation. So we talk about all of that all day long here in our office and let them know what they can do to keep their eyes healthy, and what they do to keep their eyes healthy can help them with keeping their body and overall health. And since the topic is mask, I heard that mentioned a little bit. A lot of times people don't wear masks because they fog up their glasses, and that's a real big annoyance. But there are things you can do. There are actually sprays and wipes that are anti-fog. So there are like skiers use them all the time. So in the snow, their goggles fog up. Well, we use those same. We offer those same products to help keep your anti-fog gear lenses. So that can really reduce that one big annoyance that people wear glasses and are trying to do the right thing and mask up. So.
Thank you so very much. I want to say hey to Yolanda Calico, who has joined us. She says good evening to everyone who is here. Well, what is a doctor who has DO after his name? Or should we actually say, how important is the chiropractor? Well, we have one right here. Dr. Marvin Jackson, introduce yourself and tell us when we should.
Yes, am I muted? Can you hear me?
Yes.
Excellent. I'm Dr. Jackson. I'm a chiropractor. Glad to be able to join you finally on this great panel also. Been in practice for a number of years, and people come to see us for a number of things. It all depends.
Okay. So I think Doug had some questions for you, or
Thank you, Dr. Jackson. So,
Hi, Dr. Douglas.
yes, I'm not sure you're here for the introduction, but I'm a rheumatologist. And so I thought the way that I was interested, are there certain sets of circumstances that you think are good times to see a chiropractor, and other times you think, well, maybe we need to have you see an orthopedist or someone else?
Excellent. Great question, Dr. Doug. There are certain circumstances, yes, where people see us, and other circumstances where things are referred out. So I know I didn't answer that whole question in regards to what we treat. We treat the whole body. So it all depends on what a person is coming in complaining of. There are people that treat us with different rheumatoid arthritis in the category of rheumatoid arthritis. They do see us, but it depends on, let's say, the degree in which they have the rheumatoid, because there's certain joints that should not be moved or manipulated if a person has a certain amount of rheumatoid arthritis. So X-rays, MRI is more definitive to determine that.
okay, outstanding. Well, we have another anonymous question that says, can you see a chiropractor when pregnant?
Yes, the best time to see a chiropractor is when you are pregnant. Technically before, during, and after. Because normally when the female is pregnant, she can't take any medications anyway. And everything we do is completely all natural and holistic. So I can't give her anything anyway that would, in essence, harm the baby.
Well, Dr. Jackson, how would seeing a chiropractor, well, maybe I should rephrase that question. Will it help during pregnancy, or can it help with delivery?
C, all of the above. So in regards to during the pregnancy, the hips will be expanded. So that's pressure on the SI joints, the hip in general. The center of gravity is changing, so that's going to throw off a whole bunch of things in itself. By us adjusting the spine, the pelvis, that's going to help. Also, having movement and keeping in mind that as the pregnancy, she's secreting more hormones anyway, that's going to cause the joints to become more lax, but having movement in the correct planes is going to help in regards to the delivery.
All right. So I hope I answered. I hope we got all of your question answered to the person who sent the anonymous message. What exactly is an alignment?
Oh, I love this question. Thank you for asking, Nikki. It's when you take your car in and they put it on this computer thing and they try to align the wheels. And it all depending on what model car you have in regards to the alignment. It's usually computer based now. But most of the time, though, when people come to see us for an alignment, the body naturally has curves. The curves are there to help dissipate force. And we're just trying to see exactly what joints are moving or have too much motion, which joints doesn't have enough motion. So in essence, it was labeled alignment subluxation, but in essence, trying to get the curves back into the spine.
All right. Is an adjustment and an alignment the same?
Yes, ma'am. But it all depends too on what chiropractor you talk to because there's different groups of chiropractors. So that brings a whole nother thing of mixed and straight chiropractors, but they're in general the same thing. Some people frown upon the alignment, the manipulation, the adjustment, and there's some of us that don't care. We just want to help people.
Okay. Acupuncture. Do you do acupuncture in your practice?
Yes, ma'am. And that's the beauty with the chiropractic in the state of Illinois. Taking a certain amount of hours, we're allowed to also do acupuncture, physical therapy, and a number of other things. So, yes, I do practice acupuncture to a certain extent.
Does acupuncture hurt?
Um, I actually had that question asked to me today by a patient. Does acupuncture hurt? And the amazing thing, it was a person, a guy that had a bunch of tattoos, and I could do nothing but laugh. There is a little bit of a prick, a finger prick, or depending on where we place the needle, a little bit of a prick. But for the most part, it's not uncomfortable. It's just that initial getting through the first few pricks that usually, after a person does that, they realize it doesn't hurt at all.
All right. I think Dr. Maya, well, we've renamed her to Dr. 100, which is actually her street name anyway. But I think Dr. 100 has something she'd like to share.
Oh, I was gonna ask my question was gonna be what is the difference between an adjustment and an alignment? But also I like to hear body work is the term body work is something that a lot of people who are integrative and not meaning not just looking at Western medicine is a term we use. What made you want to go into body work? Because that is, I think it's important for our community because our community, like my family is not quick to go to see the MD doctor. You know what I'm saying? They like, wait a minute, what natural things can I do before I go there? So what led you down your journey and then kind of for people out there in our community seeing you that may be thinking about like, the difference between an MD and a chiropractor and, like what led you to choose that path? Because there are a lot of paths of healing.
Yes, body work encompasses a lot of different things. Some people put massage, acupuncture, chiropractic, physical therapy, osteopath to a certain extent is also peppered into that, naturopath also. So body work encompasses everything. It's in essence, we're looking at the whole body. And it's never to the extent where we're trying to compete with medical doctors because I think in this world, everybody has a certain lane and a certain way of helping everybody. There's certain things that I can't do. There's certain things where, yes, medical doctors are needed. There's cases where we can start with basically conservative care, as in essence, physical therapy, acupuncture, chiropractic, and we can accelerate it to the higher cases of the medical doctors, the neurologists, and that to that point. That first question in regards to an alignment and an adjustment, in essence, same thing. Same thing. They would say the alignment, you're getting more than one segment. The adjustment will maybe focus on one section of the body. but in essence, it's the same thing. And then my journey into chiropractic, a little different. I'm from Alabama, born and raised. I always knew I wanted to do something medical. I chose chiropractic because of the love of puzzles. My grandmother had a love of puzzles. And to me, the human body is a puzzle. So in essence, I could, and I'm not saying medical that we see the whole body, but I could, in essence, just do a lot of different things in regards to more holistic and more things in my toolbox with chiropractic.
So then you mentioned people can come to you when they are pregnant and people come to you when they're not pregnant. What things do people typically feel? Because, you know, a lot of, including myself, I'm working on it. Go to the doctor when we hear something, we got to go get something. It's a preventive, you know, and when we're feeling something that's disturbing our everyday kind of process that we want to go through. So typically when someone feels what, they show up. Just a couple of examples.
Well, I love the fact that you just mentioned being able to feel something. That means a person is in tune with their body, because a lot of time this day and age, a lot of people are not in tune with their body. There's stuff that go on for years before they notice something. All of a sudden now they notice that they're standing in front of the TV when they used to sit on the couch. Now they're in front of the TV when they should have been getting yearly eye exams. But I mean, in essence, a lot of things bring us in. In the state of Illinois, we're considered primary care physicians. I can do almost everything a medical doctor can do besides prescribe medications. So that's where we go more into natural medicine. But again, I know my lane. If a person walks in with an infection, no, I'm not giving them something natural trying to get rid of their infection. Like, no, you need the antibiotics. If they come in with a bone sticking out, like, no, there's nothing we can do for that. But it's all about staying in my lane and knowing my limitations.
Oh, I got one more question, and then I'll. What part of Alabama are you from?
I'll start with Tuscaloosa, Alabama. Roll
Hey!
But
because your girl went to Alabama A&M. You see what I'm saying?
Oh, you on the hill. You on the hill.
Did you go to Tuscaloosa? Where do you go? Where you went?
I went to Stillman College.
You went to Stillman?
Yes.
Okay, so now I gotta talk crazy later on. We gonna on the show. We gonna be, you know what I'm saying?
Yes.
Now we gotta have this like HBCU thing going on. Yep.
Yes.
That was my question.
Okay, I'm sorry, Maya. I was too busy still laughing at you. Outstanding, Pete. You seem like you had something on your mind.
No, I was just gonna wait till these Alabama folks get done arguing, and then I was gonna tell them that they're real nice HBCUs right behind Xavier.
Really? Really?
Right behind Xavier. The finest institution there is. It's right behind.
You will look behind if you're backwards. You see what I'm saying? So I get it.
I love it.
Sure.
I love it.
Well, Mary Ballinger says, good evening, all, and I hope everyone had a wonderful new year. And Jermaine Ellen Fame is here, and she says hello to everyone just as well. Dr. Johnson, you seem really quiet in that corner. What's going on? So you're muted, and we can't hear you.
No, I was just listening to all the HBCU stuff. But I'm Arkansas born, so that's my claim to the South right there. So
okay, we got it. We got Connie Taylor asked a question. She said, doctors are the TENS unit used in chiropractic treatment, okay?
Yes, the TENS unit is. That TENS unit also can be purchased on Amazon. The transcutaneous electrical nerve stimulation was first designed for cancer patients. It basically overstimulates the nerve fibers, which in essence shuts them down, because most cancer patients complain of whole body pain or pain in a certain thing, so overstimulating the nerves. So really good unit to have. I think every household should have one.
Okay, outstanding. Well, Nellie Purnell King says, Can you use acupuncture to build your immune system?
Yes, Miss Nelly, you can use it to build your immune system, but that along with other things. The thing with holistic medicine or body work, in regards to that, there's not just one thing. Even regards to just medicine itself, you ever notice that there's always one or two things put together? But yes, you can use the acupuncture to build your immune system, but you also got to look at diet, lifestyles, being up to date on all your vaccinations and all of that too. But yes, the acupuncture can help supplement that.
Okay. We have another question that's anonymous, and the anonymous question writer said, acupuncture aid in helping with hip replacements and knee replacements. Okay, so my dog wants the whole computer down until she can get on the camera. Our anonymous writer says, can you use acupuncture to aid in pain for hip and knee replacements? So I don't want to assume. So I'm going to ask the person who wrote the question. I'm assuming that you have already had the replacement and you're asking about pain, or have you not had? So can you guys kind of give an answer for both, if they haven't had it and if they have?
Yes, the acupuncture can be used to help desensitize the area, which in essence will help with the pain. But again, if a person had a knee or a hip replacement or thinking about it, I always tell them one of the best things is leading up to the replacement, physical therapy, do everything you can to strengthen that region around and the next region that's close to that area. Then after that, because that's going to make the replacement take better, also it's going to speed up the healing time. Then after that, you want to work on scar tissue and work on the areas around it.
Okay, outstanding, outstanding. So Nelly, you sent me the word scalp, but do you want to share some more with that? We don't know it. I don't know exactly what you're asking. So while she's updating that, I see Dr. Terry Mason has joined us. Hey, Dr. Mason.
Hey, everybody.
I think he's frozen. Hey, Dr. Mason.
I'm moving my head.
Oh, okay. We see the head. You're going to do your introduction? Or did you want to meet the rest of the panel that's here? Our guest tonight is Dr. Marvin Jackson, who is a chiropractor, and he's been sharing with us the importance of seeing and knowing who your chiropractor is.
Well, I see a chiropractor as well, and I'm glad to know that he's with us today to share with us another perspective, which we always encourage. And I'm grateful to be here. I'm a retired urologist of over 31 years, and just grateful to be here. And hopefully to share what we know.
All right, outstanding, outstanding. We have another anonymous question that says, can acupuncture aid in depression?
Yes, to a certain extent, but we have to get to the root of the depression. So again, this is going to be one of those supplementary, because I also recommend in regards to depression, counseling is really good also, because you got to get to the root of it. But yes, it can help with in regards to different hormones, nerve stimulators being released.
Okay. Well, Nelly got that question straight. She says, can scalp acupuncture prevent illness?
I mean, there are acupuncture points that are found on the scalp, but it also depends on what type of illness she's talking about. Let's say headaches, head colds. Yes, it can help in regards to that, but if we're talking brain tumors and that, no. But
Can
yes,
it
there.
stimulate hair growth?
I'm sorry.
Can it stimulate hair growth?
No, I wish that would have helped me with mine. No. No. No.
All right. All right. Okay.
I think I'm the most hair challenged on this panel, so I definitely would have taken that up.
Oh, Dr. Johnson, you think you're challenged with hair?
I said I'm the most hair challenged on this panel. This is all relative.
On the head, the beard game is strong though. You see what I'm
Right,
saying?
that's what I'm saying. It's the
Everybody's
beard game.
not able.
It all
You
went
challenged
down.
with the hair?
The beard game strong. When I was younger and I saw people with beards like that, they always had on cologne and they always smell like Fahrenheit. You know what I'm saying? That's that beard. That's how you know beard game strong. Now I was gonna ask a question if that's okay. Dr. Jackson, say somebody, because my question was gonna be about like too, when they ask what can you treat? I'm a person that has headaches, you know, off and on and things like that. And so actually Zyra Gordon Smith, Dr. Zyra Gordon Smith, who is an advanced practitioner that I work with, one of my colleagues, actually went through and kind of just did some acupuncture on my, you know, and it went away. And she was like, well, come on over here. I'm gonna do this to your head. And I was like, you know. And this is somebody, I used to be a massage therapist. So I believe in body work. You know, I was like, I'm busy. She said, well, come on over here. And I was like, well, going to the clinic. And she did it. And it took a couple of minutes and it just, it eased up and it went away. Now, I know a lot of people that experience that and some other things. Where would they find you?
Well, thank you for asking, Dr. Maya. I'm located in Forest Park. I'm at 7435 Madison Street, Forest Park, Illinois. Phone number is 872-267-2225. So that's 872-267. And of course, all chiropractors use BACK. But yes, I didn't quite answer what we treat because I know I get a lot of people that ask, what does chiropractor treat? Our claim to fame is the back, of course, but we do the majority of neuromuscular issues. So most things that are causing pains in different joints, we do. Then there's chiropractors that branch out, like I do headaches, allergies, sleep issues, fertility issues. It just varies. And people come in with a number of things across the gamut.
Connie Taylor said, what about migraine headaches?
Yes, chiropractic and acupuncture can definitely help with migraine headaches. But again, we take a thorough exam to see what is causing the migraine headaches. So we want to get to what's the root of it. Is it because of the neck, the fact that they're always looking down at their cell phones? Is it hormonal related? Is it food, diet related, chocolate, red wine? It all depends, especially with Valentine's coming up.
Did you say chocolate?
Yes, ma'am. Chocolate and red wine has a connection to migraines.
Chocolate?
Take them off the screen, Nikki. Take them off the screen, Nikki.
Cocoa bean, yes.
Delete them.
Chocolate? Poor little chocolate.
You might have an immunity, so don't worry. Keep hope alive.
That's right. Now I do. Okay, to my colleagues, I'm sorry if I'm asking a lot of questions. I do have one more question. You know how when you watch people on TV and they go to the chiropractor, or you go to the chiropractor, and they do that jokingly, I call it a full Nelson. How you know what I'm about to ask? Don't be laughing like Jackson when they do that and you hear that crack. What's going on? What creates that crack? Is that, you know, can you explain what process is going on?
Yes, ma'am. We get that all the time. I thought you was going to ask me about the white scrap when they put them in the harness and they pull it really fast. That's
Yes.
what I thought you was about to ask me about.
Oh,
Yes.
that too.
That too. So the cavitation, the pop or the crack that most people call it. In essence, most chiropractors you meet, we don't care about the crack under the pop. I mean, TikTok, Instagram loves it, but we don't care. Most chiropractors don't care about it. Think of the joints when the two bones meet together. It's a capsule. It's like a basketball. So that pop that you hear, that cavitation is a release of basically a gas. Most of that gas is basically nitrous oxide. So once that gas is released, it's almost like a Coke bottle or a soda when you release it. Once that gas is released, it stimulates the nerves and the muscular around it, which in essence gets everything to relax. That in essence now, whatever spot in the brain that corresponds to that, without getting too deep, is stimulated, which in essence sends another signal, which then causes vasodilation, vasoconstriction, and then the release of basically different types of neurotransmitters, and hence that relaxation. So after the videos, most people go, oh, that was amazing. That's why.
Okay. Audrey J. Cox asks, can you please share that Forest Park address again?
Yes, ma'am.
And
Certainly.
Audrey, I will actually, he's going to share it, but I will actually type it in so you can have it as well. But please share it again.
Yes, 7435 Madison Street, Forest Park, Illinois, 60130. Office number is 872-267-2225. So BACK for the last four numbers.
So, of course, Dr. Green and I were asking, I'm just advocating for chocolate again, but Audrey J. Cox is advocating for the red wine. So I'm really unsure what that means. Anonymous question says, can not having the right prescription, or if your eyes are going bad over 45, can that cause migraine headaches?
There are some eye issues that can be triggers for that. But generally, eyesight is not a trigger by itself. Prescription is usually environmental or strain, or there's something else that causes it. It could be lights, flashing lights. There's someone has migraines. There's certain electronic tests that we don't perform because we don't want to trigger a migraine, anything like little flashing lights and things of that nature. So, but everyone's triggers are a little bit different. So any kind of strain, everyone is different, but there are some strains that can trigger migraines we try to avoid.
Okay. All right.
Migraine is also considered a vascular incident. So you have pulsating and vascular issues going on, inflammation and pulsating, and that's believed to be what's causing these migraines.
So, Dr. Miller, if someone asks, I see my doctor once a year, what's really the required number of visits you should go and see your primary care physician or any other doctor here on the panel or any other specialty doctor if you are relatively healthy? So, what's the recommendation for seeing the doctor?
The recommendation obviously is going to depending on what kind of condition. Because if you do have chronic diseases, then those diseases need to be managed, and so the frequency in terms of your encounter with a doctor is going to depend on which of these problems that you are experiencing. And so if let's say you don't have any chronic disease at all, you just, and so an annual evaluation is okay. If you have no, you're being evaluated every year, you're not having any disease, and also age is also another criteria in determining how frequent. If you're, a person in there maybe 40 or less and don't have any diseases and any chronic diseases, then probably an annual evaluation is fine, where you can have your general blood testing and those kinds of things done. But if you do have chronic diseases, then that will require that you are seen by your physician more frequently.
Okay. Hey, Nikki, I got a question. Yes, I know they've asked and answered it because I heard us use the word migraine, migraine headaches. And I just want people to know that every headache is not a migraine headache.
Yeah.
In fact, most headaches are not migraine headaches. And so there's some, and I'll defer to my internal medicine and family practice colleagues on the panel, but there is a distinction. And if you have migraines, you need to make sure that that's what you have. And you should check with your doctor for the appropriate testing just to be sure. And again, if there are any of the, if you know, the internal medicine or primary care docs on the panel might want to comment about that. It might be helpful for
Yeah.
us.
Well, yeah, that's certainly, you have to make the diagnosis, and there are specific treatment for migraines that are not just analgesic versus a lot of the other kinds of headaches. Major, if it's a tension headache and those kinds of things, other than relaxation and analgesic is what's usually would be given. But migraine is specific. It has certain characteristics, certain qualities. Oftentimes, migraines tend to be on one side of the head as opposed to being on both sides of the head at the same time. It can be preceded by an aura or some kind of warning or something that letting you know that you commonly experience prior to the onset. And as was mentioned before, migraine is related to changes in your blood vessels, usually related to vascular dilatation. And so that is the kind of headaches that we're talking about when we're talking about migraine. I know in the community, I mean, a patient used to come in, and when they had a severe headache, they would always say, "I got a migraine," but migraine has nothing to do with the severity of your headache. It has more to do with the pattern and the other symptomatology that's associated with it.
A lot of times people come to me, or they were referred by their physician or primary care physician, reporting headaches and eye strain. And one way I differentiate an eye-related headache is that you don't wake up in the morning with a headache related to eye strain. So usually the symptomatology is very, very important. Headaches related to eye strain, usually after a while, after you use your eyes a lot, fatigue or strain or prescriptions changed or whatever. So that's how I can differentiate real quickly. Well, I have headaches with my eyes. Well, do you wake up with the headaches? No, it's usually in the afternoon. And kids oftentimes will complain about headaches quite commonly, but my perception is that it's very rare for a child to have a true migraine headache. And a lot of times the children, again, it's eye strain that might be school or work or computer or phone related nowadays. So most headaches, like said Dr. Mason, are not migraines.
I just think it's important for us to make these distinctions sometimes, because we don't know. It's not that we want to have these things; it's just that we don't know, and we haven't been educated about how to tell the difference and how to best make sure you describe what you get to your primary care doc when you do see them. So thank you so much. Maya, I didn't see you weigh in on this, girl. Dr. Maya. You're muted, Maya.
The different types of headaches. I mean, I think they basically kind of already said it. You have a headache, you do need an evaluation. Migraine headaches specifically. The part that I think we talked about migraine headaches either last week or the week before, specifically the part where you have it. For some migraine headaches are aura or onset. You smell something different. You feel it. There's a certain pattern your body goes through when you're like, oh no, here it comes, and along with different sensitivities. But you definitely need to know some headaches are withdrawal from things that your body is, for lack of a better word, addicted to: sugar, caffeine, those type of things. Some headaches are stress headaches. Like some headaches are headaches because of sinus irritation, things like that. So it is definitely important to know where it comes from, so you can deal with the source of it, and which could take us down a whole other route, not just with your head, but emotionally, different ways, physically, financially, spiritually. Sometimes we look at kind of what we're experiencing or our signs and our symptoms, but they keep coming back unless we fix the cause. That's what I was thinking about, So it just keeps coming back unless you fix the root of it,
What are usually some of those triggers?
For specifically migraines or any headache?
Migraines. And
For migraines, I think Dr. I want to say Dr. Ansel, but Dr. Johnson, sorry. Dr. Johnson mentioned it can be lights, it can be stress, it can be food. Sometimes things like cheeses, wines, those type of things can trigger it. It can be environmental. Like some people have environmental allergies and they get the sinus headache, which is different from a trigger that triggers your blood vessels to dilate, which is what a migraine specifically is blood vessels dilating in tiny spaces, which is your head, and then you have your skull, which is made of bone. And while there is some kind of flexibility, y'all ever feel a baby head? Like, don't do it if y'all, it is a lot more flexible than it gets when you get 45 or 21, whichever one. But you got this tiny space, and then you have these blood vessels, and you have neurons in your brain, and different fluid channels up there, and all that is occupied in this space. Now here come these blood vessels trying to dilate and pressing against it, and that's where migraines come from, right? So
dilate means to what?
What opening up, expanding. Right. So if I got all this stuff in here in this encapsulated space, and then I'm going to try to do like this, I'm going to try to expand, then I'm pushing, the camera's this way. So if I'm like this and it's full already, and then I try to expand under it, it causes like pressure and congestion. So you got your blood vessels trying to occupy the same spaces, brain, neurons, and different fluid channels and stuff like that. And they're competing for space. And that can and all under the pressure of here, and that just doesn't work. And that's typically where migraines come from. The solution usually has some kind of version of cause the blood vessel to stop trying to expand, or what we call contract.
Yeah, one of the other common things, I mean, in terms of causes, is sleep deprivation. Lack of sleep can for people that suffer from migraine, that can certainly bring on a migraine. And for folks that use caffeine, whether it be coffee, whether it be Coke, pop or whatever that is caffeinated, withdrawing from those things are other things that will trigger migraines to occur. And hormonal changes in women, especially those that are associated with menstruation, can also cause migraine.
Thank you, because I'm having a mute struggle ministry today. I know we're running out of time. The last thing I want to say, Dr. Miller, because like you mentioned, caffeine and soda and those type of things. Why? Because caffeine constricts your blood vessels.
Absolutely.
So then when you don't have it in your body, and when you got a caffeine addiction, your body tries to rebel by being like, oh no, I'm a dilate. You better give me some caffeine right now. You better give me some pop right now, some coffee right now, some sugar right now, and it'll do that. And then what you find yourself doing is running and trying to get some caffeine so the blood vessel can go back down. And so that's why you get a withdrawal migraine. I didn't get the address.
Now, Dr. Jackson.
Dr. Graham. No, I'm just kidding, Dr. Graham. He didn't send me to Addie. I'm just kidding a little bit.
A little bit. Not totally, though.
But just a little bit. We was going to pull up.
I checked my cell phone. I don't have your number.
Okay.
Well, I didn't get it, Doug, and you have my cell phone number. Maya and I are gonna drive up.
You don't never want this double trouble. Me and Nikki, no, it's like
Doug, we coming to your house. We are on our way. We are on our way. Well, I know you guys hate to hear me say this. I know you do. I know you do. And for some of you who have left some questions, I'm going to make sure we grab those questions on next Monday. So stay tuned so we can answer those questions on next Monday. The congressman regrets that he couldn't be here with us on this evening because he is actually still voting. So they are still voting tonight, and that's why he couldn't be on with us tonight. But he does say hello to everyone who is here. And as we always say, we want to remind you to get your new trendy COVID vaccine. You know you want to stay on the trend. You always want to have the latest. So you want to have that latest COVID vaccine. You want to have the latest purse and shoes. You want to have the latest. So make sure you have the latest COVID vaccine. They are available. You can stop by any of the clinics that you see are featured here, or we can make sure that we get that information to you. In saying that, as we always do on our Monday nights, we go around our table and we ask your until next Monday. So what do you want to leave our viewers and our listeners with until next Monday? Dr. Graham, what's your until next Monday?
So I just want to express my appreciation for Dr. Jackson and Dr. Johnson. I really learned a lot. And so what it really says to me is you just can't go by the name optometrist or chiropractor. You really have to understand all the things that they have to offer and how they can help you. So just you have to kind of check them out and do some research and understand what's going on in that office and what they can do for you. Because oftentimes there's a lot more going on than at least I knew or recognized.
Outstanding, outstanding. Dr. Terry Mason, you're until next Monday.
Well, what I would hope is that the information that you heard this Monday is something that you take in and try to remember and sift through it to determine what of it is helpful to you. And just be grateful. We're grateful that we have been able to be helpful to you. And that's our goal, is to give you some information you can use to better yourself. So that's the real purpose. And we hope that you continue to listen, because the doctors and others that have come on this show have put out a lot of good information like you heard tonight. So, and it's always, in God we trust, all others must have data. So let's take that and thank you so much for being attentive and sitting here listening. We appreciate you too.
Outstanding, outstanding. Dr. 100, that's Dr. Maya Green, that is. You're until next Monday.
it might be time when they say it to bust out those. You talking about the latest vaccine? Get your mask game up. You know what I'm saying? Now they make them with rhinestones like Nikki like them, but they can't. Don't get the ones that's like lace, because that defeats the purpose unless it's lace on top of something else, right? So over the nose, under the chin, and just kind of gear up. Start making a plan. Start getting your kind of natural foods, your beans and all that other stuff ready, just in case, and then, start thinking about what you're going to do to protect your tribe. Because once again, COVID was one of those kind of things that happened to our community that tested our ability to move as one unit, one human race, right? And when we began to move towards getting it right, one human race, vaccinating equitably, making medication available, making the vaccine available, making the testing available. Then we began to see some movement, in a positive direction, right? So kind of start thinking about that. Start thinking about how you're going to protect your tribe, not only just for COVID, but a lot of times the lessons we learned during that time should be extended into our everyday life. So,
So Maya, is this correct? Is this correct?
Absolutely not. I should not be looking at your mouth and your nose. Do not. And Dr. Ansel mentioned, not the cell phone, not the old school 80 cell phone. That's the old, you had the beard, the old school 80 cell phone where it's hanging off right here. No, that's not right.
Is that correct? What about this?
If I'm looking at your nose, you can't cover either the mouth or the nose. It don't count. You got to cover both. picked up. Oh, thank you. Thank you. That's what I was thinking when I want to call you Dr. Ansel, when Dr. Johnson, sorry.
Get that anti-fog spray for your glasses.
I was thinking, right. I like to lift up my mask and do the little metal part and sit the glasses on top. It doesn't work as well as what Dr. Johnson mentioned, but if you don't have those sprays yet, if you don't have them yet, I mean, I would get them now because you know the price gonna go up. You know, if COVID gets a surge, but get ready, wear your mask right, so we can see you on the other side.
Yes, sir.
But I will say, until I can get some anti-fog spray, I will walk blurrily without COVID with that mask on. Absolutely. Dr. James Miller, you're until next Monday.
Yeah, just to remind everybody that we're all in this boat together, and to not be selfish, but to do what we can to help each other. And COVID is certainly one of those kinds of condition or kind of diseases that we need to be concerned about how we help others, not just what we help. If you're 20 years old and healthy person, COVID may not cause a big problem for you. It might, but it may not. But grandma is certainly going to be it's going to be a problem for her. So even though you may go out and do things and you get infected, be careful and make certain that you don't share that COVID infection that you had with her. So if you can keep from getting COVID yourself, you can share Grandma Law without worrying about sharing COVID.
Outstanding. Outstanding. Dr. Johnson, you're until next Monday.
I want to pass on some words of wisdom, and it's such a blessing to be on this panel. I always get excited about trying to share our knowledge, and thank you, Dr. Graham, for recognizing sometimes it's good to have different viewpoints. You know, we all have training in different paths, but we're all trying to move to the same direction and raise up our whole health situation for our community. So just want to share this. Invest in yourself, in knowledge, skills, and health that are assets that will serve you your entire life. And again, that's the blessing I think this panel gives to everybody about educating the community. So that's my vision for everybody in the week coming up.
Outstanding, outstanding. And our guest this Monday night, we hope you had a great time. You're until next Monday. What would you like to leave everybody with as their golden nugget for the
Thank you. It was a pleasure being invited. I'm going to kind of build and talk about, like, similar to Dr. Johnson. My thing is health is wealth. One thing you can never get back is your health and time. So I think this panel is amazing. So many different thought process into different conditions that are going on. This is needed more. So health is wealth. Protect your health.
Outstanding, outstanding. Just want to give a brief announcement. Know that February 14th is coming, and I know that February 14th is Valentine's Day, and it is a Tuesday. However, the congressman will be sponsoring a Health is Love mini symposium, and you all will be invited out. Stay tuned. You'll receive a Save the Date tomorrow, and we will be posting a Save the Date tomorrow. And on Friday, you'll get all the information. Well, there'll be limited seating in person. However, we will also have a social media link where you can view us. Some of your panelists right here will be in attendance to have a conversation with you. It's really going to be somewhat of our live couch conversations with the doctors, where true health is wealth. Once again, until next Monday, we'll see you then. Stay healthy, stay wealthy, and stay wise. Have a great Monday.